Something that I think has been very helpful in developing what I'd like to think is a good reputation over the years is that I always focus on managing a new patient's expectation. Sometimes it's not easy to do because if there's a need for treatment, you want to convey that need and you want to get the patient excited about it and you want to convert on that treatment. And so you can promise a patient everything and you can answer yes to all their questions. But at the end of the day, if you don't have a happy patient, it's not going to be helpful in growing a practice. When it comes to orthodontics, there are really two areas that I think exemplify this. One has to do with the shape and the condition of a patient's teeth, and the other has to do with the size of their teeth. So I'll give you two examples. I treat a lot of adults over the age of 50, and many of them have uneven edges of their teeth, the chipping of the edges of their teeth, the incisal edges. Sometimes they have darker teeth, and they may not be aware of these things. They're coming to you for orthodontics, and they may think that when they're done with the treatment and the commitment and the cost, that they're going to have a Hollywood smile. I think most realize a little bit that their teeth maybe could be bleached, but a lot don't realize that the edges of their teeth are quite chipped and worn, especially if they have crowding, because usually crowding is featured with an inward positioning of the teeth, which leads to wear over the years. And so I tell new patients that when I line up their teeth, they're going to love it. It's going to be easier to clean. More light is going to reflect off their teeth, but they might be aware that their teeth are shorter than they actually think. And I can see sometimes a patient will be thinking about this, and it could even put a damper on their excitement. But I say to them, that's okay, because I'm like the orthodontist that is going to be the structural foundation creator. We're like structural engineers, but sometimes, to push that metaphor, the facade of the building needs a little bit of spiffing up after that. And so I'd rather let the patient know this than have somebody who's unhappy at the end, because I have had patients who say to me, hey, this tooth, I think this chip, did the aligner chip this? Did the braces chip this? And I have to show them the picture. So this is very important to explain to older patients that we only have control over moving the teeth, but not changing the shape of the teeth. The other area that applies, whether it's an adult or to a younger patient, involves space closure cases. When people have gaps between their teeth, quite often the orthodontist focuses on closing those spaces by bringing them inward and together. And that is the right treatment in a lot of situations when you've diagnosed that the teeth were sticking out or spread apart too much. But quite often, the root of the problem is just that the teeth are narrow. And sometimes orthodontists take on a case wanting to make a patient happy, or because as an orthodontist, they're kind of myopic, thinking I need an orthodontic solution for this. So quite often I find myself telling parents of younger patients and patients who are adults that, hey, you know what? This is not a good orthodontic case because the tooth positioning is okay. You really need to have the width of these teeth enhanced. And sometimes people just dismiss veneers. Sometimes they think I'm crazy, or they say, hey, you're the orthodontist. I didn't come to you for veneers, that kind of thing. So very important when you're diagnosing a space closure case to look at the width of the teeth. What usually happens is I will, if not close the space all the way, I will tell the patient we're going to progress. And at a certain point, I may think that for your bite and for the look of the full smile, that we're best not closing the space all the way. And I even give them some renditions to look at this and say, here's what I think would be the best fit for you functionally as well as cosmetically. And then afterwards, you can have a dentist close the spaces with something that could enhance the width and shape of the teeth. Patients may not start treatment, but you know what? It's much better that way, in my opinion, than having somebody at the end of treatment who's not happy with the look of the teeth because maybe you pushed them inward too much, or maybe you couldn't close the spaces all the way when you told them that you could. So this is a good tip for younger orthodontists out there and even general dentists. And I think experienced doctors know this. Manage a patient's expectations rather than trying to sell them and answer yes to all their questions.